Hello students, and welcome to Ethical and Legal Issues in Healthcare. In today's session we'll be talking about therapeutic goods. So therapeutic goods. So in terms of the overview of what we'll be talking about the classification, so listed and complementary alternative medicines, the Therapeutic Goods Act, and also the Poisons Act is the legislative framework under which medicine is actually governed. So as many of you probably are aware, the Therapeutic Goods Administration is the regulatory authority that actually looks after the medicine and vaccines and the way that government actually regulates the area of pharmaceutical and non-pharmaceutical products. So in terms of the legislation, the TGA, as the Therapeutic Goods Administration body or association, actually has its power or derives its authority from the Therapeutic Goods Act of 1989. And as you can see, it's actually quite dated, a dated piece of legislation. So the Therapeutic Goods Act and the TGA as a separate body run under the governance of the Australian Government Department of Health, which is what you would actually expect. The function of the TGA, as enacted by the legislation, is to carry out testing and monitoring of therapeutic goods to ensure that they're an acceptable standard in Australia. So this obviously includes pharmaceutical products that are manufactured overseas. And it's to ensure that there's a level playing field, that there's a benchmark of quality, and there's checks and balances in terms of what's introduced into the Australian market to ensure safety and also efficacy, that they're efficient, that they do what they purport to actually, what they are marketed and what they purport to do, that they have that effect. So the therapeutic goods, in terms of the legislation, are defined as those products that are represented as having a therapeutic purpose. They're likely to be understood as having a therapeutic purpose. So even if they're not represented in those indirect words as actually having a therapeutic effect, that it's inferred in the way that it's marketed or in the way that it's labelled. So that's what we mean by likely to be understood. So it's perceived as actually being of a therapeutic purpose, or under the TGA specifically as labelled and defined as having a therapeutic purpose. So in fact, you can see that there's quite strict regulations for therapeutic goods and what the public can come to understand them to actually be and to mean. Now, as I said, the Act is what actually regulates the role of the TGA in governing this area of law and this area of health. And the Act is actually quite specific. It sets out the requirements for labelling, also advertising, and the appearance of therapeutic goods. And the reason why the Act is quite specific in this regard is to gain some sort of control and to ensure that what's disseminated to the public in terms of actually being of health benefit, of being of a therapeutic benefit, is actually meets the standard in Australia. So advertising, obviously, as many of you probably are aware, of prescription medicine directly to the public is actually prohibited in Australia, whilst advertising to health professionals, so marketing to health professionals, does in fact comply with legislation. And that's why you'll often actually see pharmaceutical reps go out to see health professionals at their premises. Usually it's doctors, sometimes pharmacists. They go out on site, actually meet with them and market to the health professionals. But direct marketing is not in fact allowed to the public. So direct marketing to the public is actually prohibited, which is quite unusual if you look at the international experience. Now, the reason for this is because it's perceived that the health professional is actually the gatekeeper of the information, that they're the ones who can actually disseminate the information, can interpret the information and make it individually relevant to their client or to their patient. So they become the gatekeeper who actually liaises with, if you like, the pharmaceutical companies and the direct customers or clients, knowing clearly that the effect of taking the wrong medication can be quite damaging. The other piece of legislation that you need to be mindful of is the Poisons Act of 1966, and that's even more dated. And the Poisons Act actually is the piece of legislation that goes directly to the packaging, the labelling and the storage of pharmaceutical products. And that's covered by the Poisons Act, as I said, of 1966. And pursuant to this act, poisons must be packed in secure containers. Containers of 2.1 litres or less must have a starred or a ribbed surface. And you'll often see the lids where you actually need to push them down and actually turn them to make sure that they're child safe. As well as that, in terms of the warnings, there must be the words poison, warning or caution that needs to actually be listed or labelled on the actual product. Where the substance is not intended for internal use, there needs to be the words not to be taken, which you printed on the label. Keep out of reach of children must appear. And for some substances, first aid treatment instructions are also required. So as you can see, it's quite regulated and quite controlled, knowing that the effect of taking the wrong medication or medication taken by the wrong people can actually have some serious health consequences. So in terms of what's actually covered here, what do we mean by therapeutic goods? Well, there are three main classifications. There's listed goods, complementary medicine, and also registered goods. And we'll go through those one by one so you're clear about what we mean by those. So listed goods are goods, for example, vitamins and sunscreen that have demonstrated quality and safety but aren't necessarily regulated or controlled or tested for efficacy. So what that actually means is they're usually quite relatively benign or considered to be safe products that don't have strong adverse effects, but they're not actually judged or tested for whether they work or not. So as I said, typically what actually falls in this category are vitamins or sunscreen or other health promoted products that don't have or aren't considered to actually be dangerous if taken by the wrong person. The best it's considered that they'll do is not work. So they usually have an L number on the label as proof of listing by the Therapeutic Goods Association. They don't contain substances that are scheduled in the Poisons Act. And like I said, they're listed medicines for quality and safety, but not efficacy. So this means that the TGA has not evaluated them to actually check to see if they actually work. So I'd encourage you, I guess, to have a look at what you have in your cupboards and see if you can actually find the OST-L number on the label as evidence of the fact that it has, in fact, been looked at by the TGA. Okay, complementary medicine can either be listed or registered depending upon their ingredients. And as you can imagine, complementary medicine is quite broad. The level and the difference in terms of the ingredients of what's in them are quite varied. So most complementary medicines are in fact listed products because they're considered to be low risk, but depending upon their ingredients, they may in fact also be registered. And we'll talk about what registered products are in just a moment. So just to finish off our discussion about complementary medicine, so there is a registered non-prescription category for those products that have a higher risk or make more serious claims. Complementary medicine sort of toggle between the registered medicine and the listed medicine. There is some evaluation of it in terms there's an evaluation committee who provides advice on the safety and the quality and sometimes the efficacy relating to the claims made for it to be included by the Therapeutic Goods Administration Board. But also, registered medicines must display an OSTAR number on the label as proof of registration. So, as I mentioned, sometimes complementary medicine does in fact move into that area of actually being registered medicine as well. Now, registered goods are those such as prescription medicine that in fact have been tested and do demonstrate quality, safety and efficacy. So these are usually the pharmaceutical products that you get a prescription for from your doctor and actually pick up at the local chemist with that script. That's usually what we're talking about there. Okay. Okay, so thank you for listening to today's session and see you next time.